Hello, my name is Wendy Mabry. I'm 55 years old and I'm a happy patient of Dr. Roberts. I have a regular exercise routine that I've done for quite a few years. I started noticing some pain in my left hip when I was on the treadmill, and I thought it was something due to my workout. I thought I probably strained it, and I didn't think much of it, and then just went on with what I was doing, and it just got worse and worse. I was going on a vacation in Boston in August. I was just very uncomfortable on the trip. We did a lot of walking, a lot of sightseeing. As soon as I got back to town, I went ahead and made an appointment. Dr. Roberts was recommended by Dr. Daggett as his hip specialist. So I went ahead and made an appointment with him, and we decided to go forward with the hip replacement. His office had been wonderful as far as answering questions, telling me what to expect. They'd actually listen to everything that I'd say and make sure I had all my questions answered. Went ahead with the surgery. I only spent one night in the hospital. I had home health come to help me with therapy for about a couple of weeks. And then I went to physical therapy for the next month, and then Dr. Roberts released me.
Wendy first presented here to the group. She had quite a bit of hip pain. She was diagnosed with advanced arthritis of her hip. She was a very active female for her whole life. She still partook in a lot of activities such as exercise. She was having a lot of pain and wanted to find out answers. She went through different rounds of therapy, tried all the other options, and including injections into her hip that helped for a little while, but then just didn't last for her. It began interfering with her activities of daily life, and so she wanted to discuss further options. We discussed hip replacement for her. There's three major types of hip replacement approaches, and I knew with her that she would be a good candidate for the anterior hip replacement. It does allow patients to bounce back a lot faster because you aren't really cutting any muscle off. With the anterior approach, you're just kind of splitting between muscle layers. So it really just becomes kind of rehab and getting the strength back to those muscle groups, mainly the quads. It doesn't require the healing process that the other parts do when you cut the muscle off and repair it back down. Wendy did tremendously after surgery. Like a lot of my patients, she was able to get out of the hospital within a day and get on with her therapy. She was on her feet right away. I tell patients usually maybe a walker for the first couple weeks and hopefully to a cane by 6 weeks, and then start ditching that and get back to your normal walk. She, at 2 weeks, was barely using her cane. She was doing really well, and since then has just continued to get back to her activities and back to her active lifestyle.
I'm so glad I had it done. It needed to be done, and it wasn't going to get any better on its own. I know a lot of people my age and maybe a little older are putting off having these types of surgeries, and I would recommend this type of surgery to anyone who's putting it off, because there's no need to live in pain if you don't have to.